Rotation is now changing and my shift is over. I will now be briefing you on our newest patient so that you can take over. At 11:15 p.m., our patient arrived. The visit was considered an emergency consultation as the patient came in with extremely high blood pressure and abnormal bodily edema. The patient is a 24-year-old female who is 27 weeks pregnant. Her patient ID number is 179410 and her birth date is June 4th, 1996. The patient does not have any known allergies but takes Lexapro for depression and had a ritidectomy and Botox injections performed a few months before she became pregnant. The patient stated that she had been tracking her blood pressure throughout the night and was alarmed by such high numbers. The patient's vital signs have been examined and are currently being tracked. The patient has a temperature of 99.1 degrees Fahrenheit and a pulse of 85 beats per minute. She is experiencing hypertension as her blood pressure is indicating 140/90. She weighs 148 pounds and is 5 foot and 3 inches tall. The patient exhibits normal physical appearances of pregnancy, but swelling in the crural region is apparent. Heart rate is indicative of minor tachycardia, measuring at 99 beats per minute, but no abnormal sounds were detected. Breathing is normal and the lungs sounded healthy. The patient does not have any pain in the abdomen, but an ultrasound was performed to gather diagnostics of the baby. My first impression of the patient's symptoms was that she might be experiencing preeclampsia due to her extremely high blood pressure. This is not uncommon in the third trimester. Upon collecting a urinary sample and analyzing lab results, samples of protein were found in the patient's urine. A blood test also indicated thrombocytopenia due to the very low platelet count. A fetal ultrasound showed a lack of amniotic fluid in the uterus. Furthermore, the baby was exhibiting a very high heart rate. Over the past 4 hours, blood pressure has been monitored and there has been some improvement. Preeclampsia, also known as toxemia, has been a confirmed diagnosis. I have prescribed the patient anticonvulsant medications in order to prevent seizures. Right now, we are giving her this medication through an IV. The patient will stay in the hospital for the next 24 hours in order to monitor her condition. Antihypertensives will also be prescribed in order to lower blood pressure. If the patient does not show any signs of improvement over the next day, since she is so far along in her pregnancy and almost at the point of delivery, she may need to be induced into labor to protect the fetus. Furthermore, an emergency C-section might need to be scheduled if condition progresses. Thank you.